In the video series of Neurology Medicine, today I will discuss encephalitis. So what is encephalitis? Encephalitis, it is the infection of brain. It is the infection of brain parenchyma with evidence of neurological dysfunction. So encephalitis is infection of brain substance which is mainly associated with the neurological deficits. Patient with encephalitis usually presents with the history of infectious prodromal phase. They have a history of infectious prodromal phase. In infectious prodromal phase, there is fever, rashes, and lymphadenopathy, right? In the infectious phase, there will be fever, rashes, and lymphadenopathy. After prodromal phase, it lead to odd behavior, decrease level of consciousness, and focal neurological deficits. So let's talk about pathophysiology. So whenever there is infection in the brain, so that might be viral infection or non-viral infection. So let's say if there is viral infection or bacterial infection in the brain, so it lead to cerebral edema. It lead to cerebral edema, congestion, which result in hemorrhages, which lead to degradation and necrosis of brain cell. It lead to degradation and necrosis of brain cells, which results the demyelination of nerves. So when there is demyelination of nerves, then ultimately it lead to focal neurological deficits. So if there is infection in the terms of viral or bacterial, so it lead to cerebral edema, congestion and hemorrhage, which lead to necrosis and degradation of brain cells. Ultimately there is demyelination of nerves and there is focal neurological manifestation. Now let's talk about the types of encephalitis. So there are 5 main types of encephalitis. And what are those 5 types? The first is infectious encephalitis. In infectious encephalitis, it is mainly due to infections and most commonly it is because of viral infection, right? Encephalitis because of infections, that is infectious encephalitis. And another type is post-infectious encephalitis. Now in post-infectious encephalitis, the patient had a history of infection before or there is a history of vaccination. So it may arise due to the complication of vaccine as well. So that is post-infectious encephalitis. The third is autoimmune encephalitis. Autoimmune encephalitis, and when our immune system it react against the non-infectious causes. Most commonly that is tumors and antibodies. So that is autoimmune encephalitis. And there is Japanese encephalitis. So Japanese is also a type of virus which cause infection in the brain in terms of Japanese encephalitis, and it is usually spread through mosquitoes. And then there is chronic encephalitis. Now the infection in the brain, it takes few months and it develops very slowly and gradually. So that is chronic. Now what are the signs and symptoms? So there will be bizarre encephalopathic behavior, means there is alteration in the time, place and person. Also there will be decreased consciousness level, there might be coma, The patient may present with fever, headache, and focal neurological deficits. The patient may have a history of infection, or they have a history of animal bite, or they have a recent travel history. If the prodromal phase is absent and the patient has altered mental status or a patient is deeply comatose, then that is called as encephalopathy. Encephalopathy. Now, encephalopathy is somehow it is different from encephalitis. Encephalitis is the infection of the brain substance, but encephalopathy it is mainly associated with the metabolic causes. So whenever there is encephalopathy, so there are different DDs that you should have in your mind. That may be hypoglycemia, hepatic encephalopathy, that might be drugs, and SLE and DKA or ischemic hypoxic brain injury. What are the causes of encephalitis? So there are viral causes and non-viral causes. The most commonly the cause of encephalitis is viral causes. So in viral causes, most commonly herpes simplex virus type 1, it is most common cause for the encephalitis. It is very important that the most common cause of encephalitis in any age group, that is herpes simplex type 1 and encephalitis. In the patient which is infected with the herpes simplex virus type 1, they are usually presented with the fever, headache, body aches. Also there could be blisters and skin rashes. So these are the certain typical features for the herpes simplex. Varicella zoster virus, and it can cause the encephalitis mainly in old age patients, right? In old age patients of encephalitis, they are usually infected with varicella zoster virus. Now, what are the other causes? The other causes are cytomegalovirus, Epstein-Barr virus, arbovirus, and West Nile virus and enterovirus. What are the non-viral causes? So in non-viral causes there is TB malaria. TB malaria, it is the most common non-viral causes for encephalitis. The other causes are Lyme, Listeria, and Cryptococcus. Let's talk about investigation. So the first of all, it's important that you should do the blood culture. The blood culture is important in case of encephalitis, and it will tell you the source of infection of the encephalitis. And also you should do the malaria film for malaria as well, right? And also you can do lumbar puncture. You should do lumbar puncture, and lumbar puncture most commonly you can see lymphocytic pleocytosis. So lymphocytic pleocytosis, it is seen in the viral infection. So in this case, you should do the PCR for different viruses, and you should do the serology, most commonly IgM against these viruses. And contrast enhanced CT scan. Contrast enhanced CT scan, it will tell you the bilateral temporal lobe involvement if the cause is herpes simplex virus. So please keep in mind, whenever you do the contrast enhanced CT scan, so there will be bilateral temporal lobe involvement. Most commonly, whenever the infection is caused by herpes simplex viruses, and as you know that the most common cause for the encephalitis is herpes simplex virus 1. So because of herpes simplex virus 1, you can see the bilateral temporal lobe involvement. Now if the patient is allergic to CT scan, so as alternatives you can do MRI. You can also perform the electric encephalograph, which detect the electrical activity in the brain, and it will help in the confirmation of diagnosis. What is the treatment for encephalitis? So keep in mind, the untreated encephalitis motility, it is up to 70%, right? The untreated encephalitis motility, that is up to 70%. So it means whenever the patient is diagnosed with encephalitis, so you should start treatment as early as possible, right? So it's important. Anti-inflammatory drugs. Now this anti-inflammatory drugs, it will decrease the infection in the brain. You can give the acetaminophen and you can give the ibuprofen as well. Now the second is you should give the antiviral drugs. Now in antiviral drugs you should give the acyclovir and cyclovir. If you suspect the cytomegaloviral infection, so in that condition you have to give the genciclovir, elasoscarnet, right? So it's important. Now in antiviral drugs you have to give acyclovir and cyclovir, and then if the encephalitis is because of cytomegalovirus, then at that condition you have to give genciclovir and foscarnet. Also you can give the immunosuppressant drugs. You can give immunosuppressant drugs and it will decrease infection as well, like in the terms of corticosteroids you can give betamethasone and dexamethasone. Also supportive treatment in terms of oxygen and you can give IV fluids to the patients, and you can give the anticonvulsant drugs to the patient if there is seizure. So student, that's all about encephalitis.